For sure, this trip was an experiment. Clearly, it was absolutely worth going.
We've learned that there are ways to look at problems differently and deeper than what we've ever done before.
Salem Health Chief Executive Officer Norm Gruber and Chief Operating Officer Cheryl Nestor-Wolf were part of a diverse group of hospital staffers who embarked on an immersive trip to Japan in October. Everyone from executives and support staff to doctors and nurses all experienced Kaizen, the Japanese strategy for continuous improvement.
That group really congealed as a group, and in fact, titles disappeared very rapidly. It was really interesting to watch.
And we talked to a lot of healthcare providers who had gone, other industries that had gone, and said, you won't believe it until you see it.
The group soon learned the trip was not as important as the transformation they would each experience. They witnessed the Toyota production system firsthand at an automobile assembly line.
When you look at our emergency department as an example, it's an orchestra of events. So you're certainly, a patient is not a car. Absolutely not. But the work that people do to make that product or that patient better is very similar. We take care of patients. So ours is really about how do we take exceptional care of our patients every single time that they work with us for their health.
Gruber believes Japanese culture is more cohesive and collaborative than in America.
This idea of working as a team, working together, working with the workforce at the front of the line, I think comes more naturally than it does here in this country.
The group also observed the workflow for 3 days in a gas meter plant in southern Japan. The group separated into 4 teams that each came up with lists of possible changes for the plant.
There was actually some 40-some changes that we identified in the 4 teams that factory either put in place or were going to put in place that were all Kaizen process improvement projects.
How engaging it is and how exciting it is, and that the improvements are things that we already know how to do to some extent, but that this really deepened our understanding of how to do it really well.
So I think taking groups away to have that kind of experience, wherever that might be, I think is an absolutely critical element of this. It gives us a framework now that we can say what did we gain from that, and what parts of that do we want to continue down the road. And I think we're still evaluating that issue.
Nestor-Wolf says Kaizen's emphasis on respect for people became her most clarifying moment.
Honoring the work that people do every day, their understanding of that work and their ideas about how to improve that, and it is leaders facilitating people to do that better.
What we're examining now is, can we do some of the same things we did there in this country?
I think to some extent the public has already seen a difference.
Nestor-Wolf says Salem Health's emergency department has gone through a big transformation recently.
Today we're a top-performing organization in our emergency room, and that, I believe, is this engagement, this collaboration, this change in the way that we look at our patients and manage them, the intensity of service.
Leaders also plan to begin going on rounds throughout the hospital regularly with a special purpose.
How do you get the managers, and that includes myself, we're all managers, on the front line on some regular basis to really understand the issues that the front line folks have to deal with on a day-to-day basis.
Everybody owns the change, so you get much deeper change that way. It's not quick, but it's not intended to be quick. I think that's been a mistake in healthcare, is to do things too fast.
The Japan trip ultimately reinforced Salem Health's commitment to change. Leaders say the Salem Health Production System will take shape over the long term and is the process for how the organization needs to do business to be successful in the new healthcare economy.
I am committed, I think our leadership is committed, our board is committed to this very long journey.